Sekolah. Saya sekolah. Tapi Inggris.
Tapi lebih pas. Iya betul.
Saya udah lama sih, udah.
Warahmatullahi wabarakatuh. I would like to welcome you all to panel discussion 1, Multidimensional Poverty in the Midst of the COVID-19 Pandemic. First of all, I would like to introduce myself. My name is Niken Kusumawardhani, and I am so glad to be your moderator for today's event. First of all, I would also like to extend our warm welcome to honorable panelists, and I would like to invite 2 of them into the stage. So please, Mbak Rizki Fillaili from the SMERU Research Institute, and also Pak Elan Satriawan, please come on stage. Mbak, iya, ya, silakan Pak Elan. Ya, Pak. Oke. Thank you, dear panelists. I would like also to extend our warm welcome to the distinguished T20 community and all participants who are joining us here at the Mandarin Hotel Oriental, and also those who are joining us via Zoom and YouTube. I hope everyone is keeping well and safe. Before we begin, I would like to thank our partners for their generous support for this event. This event is made possible by the collaboration of Faculty of Economics and Business Universitas Indonesia, with the SMERU Research Institute as the host institution of Task Force 5, as well as with the OPHI at the Oxford University. Secondly, I would also like to thank Astra International and Bank Rakyat Indonesia for their generous support as sponsors. Ladies and gentlemen, the COVID-19 pandemic has exacerbated and shone a light on many issues of poverty, inequality, human capital, and well-being. We have seen how the crisis has brought unprecedented challenges for countries around the world. After years of progress, poverty is rising again. Poor households will remain or in a deeper state of poverty given their declining of resilience. However, the COVID-19 pandemic is a stark reminder that poverty is not just about income. Within and across countries, poor and marginalized communities are disproportionately affected in terms of infection rates, learning loss, access to vaccines, or other healthcare imperatives. Understanding the multidimensional nature of poverty can help us design a more resilient recovery that leaves no one behind. Ladies and gentlemen, we have the privilege to discuss today with our three distinguished speakers during this session. And I would like to briefly introduce them one by one. So we have Mbak Rizki Fillaili from the SMERU Research Institute. So maybe Mbak Kiki, you would like to say a little wave to the audience. Mbak Kiki has experiences in conducting a participatory assessment of poverty, vulnerability, and other social issues using sustainable livelihood framework. And she is currently pursuing her PhD at the Australia National University in Canberra. Mbak Kiki, we're happy to have you join us at the venue today. And our second speaker is Bapak Elan Satriawan. Pak Elan is an economist with significant experience in academics as well as policy making. Pak Elan also serves as Chief of Policy Working Group at the National Team for the Acceleration of Poverty Reduction, or TNP2K, where he provides advice to the President in taking strategic policy decisions on poverty and social protection measures. Hello, Pak Elan. It's also very happy to have you here at the venue.
Selamat pagi semua.
And also to join us from the online is our third panelist, Dr. Usha Kanagaratnam, who is a Senior Research Officer at the Oxford Poverty and Human Development Initiative. Usha leads the Global Multidimensional Poverty Index project, and she's joining us online from Malaysia. I think she will be somewhere over here on the screen, maybe later. So I'd like to say hello to Usha if you've seen us on the stage, and we're also very excited to have you as joining from your place. So ladies and gentlemen, for the next 90 minutes, we will have discussion with this panelists one by one, and then at the end of the session, we will have a Q&A discussion. So maybe I would like to pose the first question to Mbak Kiki. Mbak Kiki, in assessing the impacts of COVID-19, it is very important for us to adopt a multidimensional perspective of the poverty itself, because it will help us in designing a more proper policy towards the poor and the marginalized. Based on your recent research in Indonesia, would you like to share with us what are the impacts of the COVID-19 pandemic on poverty and other livelihood indicators at the household level? And also, how can government design policies for the poor and marginalized group to regain their strength and resilience to achieve sustainable recovery from the pandemic?
Okay, thank you for the questions, Niken. Today I would like to use the opportunity to present study findings that was conducted in collaboration between SMERU, UNDP, UNICEF, and Prospera on the socio-economic impact of COVID-19 pandemic at the household levels, where we look at various aspects, not only income, but also on health, education, mental health, and also focusing on children, women, and people with disability. So, could you please show the presentation slides? Okay, next slide, please. Yeah, as I said before, that this is the study that was conducted actually at the end of 2020, when we actually at that time experienced the first wave of COVID-19. So probably what I can say here that we can use and learn the results from this study to formulate policy discussions and also recommendations. What can we learn from the findings? So the survey was conducted at the national level using a mixed method, combining survey and also interview with the household that we assume are affected by COVID-19 pandemic. Particular attention was given to children and other groups, women and people with disability. Next slide, please. Next one. We can see here that actually the COVID has impacted household, and the impact has been very severe and is likely to continue in 2021 and beyond. The study shows that 3 from 4 households that we interviewed has experienced reduced income. And we also interview people who lost their jobs and switched to informal jobs from their formal one. because of the pandemic. And we learned that during the COVID, that many households, actually 1 in 2 have no saving at all, meaning that they have to rely on their assets and even have to sell their own properties to finance their daily needs. And almost like 9 in 10 family business were hardest hit by the pandemic, meaning that their income are reduced due to decrease in buyer. Next slide. Next one, please. And particular attention was given to children, where we learned that children are facing multidimensional challenges in terms of income loss experienced by the family. The children themselves have been in the stage of learning loss. They also have problems with their health conditions and experience other risks. For example, in terms of learning loss, around 64 parents concerned about disruptions due to the online learning process. And that in terms of a health condition, we interviewed people or parents who observed that their children were in a stage of anxiety and also getting, angry almost all the time because sometimes they are hungry, and also they cannot, follow the lesson very well during this hardest time. In terms of other risks, some children are also afraid of getting infected by COVID. So the situation for children are very severe and also needs more attention in that matter. Next slide, please. This is continuing to the previous slides, that the challenges from learning from home was due to the unequal distributions of quality internet. As mentioned during our previous panel sessions, more than half of them do not have reliable internet, even in urban area. So unless it is well addressed, we assume that children will continue the process of learning loss for some time. The next problem is due to the inability to have proper learning device, such as laptops or handphones, to learn properly. And the other problem is due to the inability of parents to accompany children while they are studying. This is lead to the other problem of unequal distributions of household chores at the household level, where women bear the most burden in taking care of their children and also do other household works. Next slide, please. Here is the numbers where we learn that gender inequality widen as women take on more responsibility. One message from here is that during the COVID-19, we see that actually there is no equal distributions of household chores between men and women, and it may continue for some time, because even during the disrupted time, there has not been changes at all in the previous practices. So this is also a thing that we can put more attention to. Next one, please. Now, for people living with disability, they are struggling because from 8 in 10 people with disability, they cannot have access to the services they need in terms of health services, and they have to suffer from the loss of income that their parents experience. They also have problem to go just to buy, for example, shoes to support their daily activities, because parents also lost their income. So probably these people are in the bottom of a group experiencing the hardest hit from the pandemic. Next one. Now, in terms of the mental health, we also learned from this study that both children and adults is experiencing a condition where it requires a proper intervention and attention. For example, we learned that unhappiness, depression, and excessive anxieties are commonly occur among households who has been severely affected by the COVID. The main reason mostly are related to money and job issues, and also because of the burden that unequally shared in the household level. Children are under stress, find it hard to concentrate. Some even do not continue to school. Next one, please. I think this is the last aspect of livelihood, where COVID has a toll impact in terms of food insecurity. We see that it is actually the food insecurity is on moderate to severe level, but this trend can continue or getting worse if, for example, social assistance in terms of cash assistance, for example, is lifted by the government. So it is a watch point indeed. Next one, please. So what are the key recommendations that we propose from this study? Next one. Is first that actually social assistance has reached many people in need, but it could reach farther. Like 80% of the respondents that we talked to have received at least one form of social assistance. We also learned that there are households who receive more than once, means that they actually get proper help and get more benefit from the assistance, but there are still exclusion error, meaning that there are households who are eligible but still do not get the assistance they need. Next one. As I have said before, that many people receive complementary assistance. This is a good one. Some households receive staples and also cash assistance at once. Some also get electricity subsidies, meaning that the government has tackled many aspects of household livelihood at the times of pandemic. Next one. In terms of business support, we learned that very few actually has received government assistance in terms of cash for them. This is unfortunately because the program has just started due to the pandemic, and there are still very little socializations or information disseminations about this program, which make many households do not know then and then do not get this assistance. Next one. Nevertheless, there is a room to reach more poor and vulnerable households, as I mentioned, with a better database and integrated database. I think we can reach more people, poor household and vulnerable household, to receive assistance from the government. Next one. This is what we can suggest to build more effective social measures to reach more people. First is expanding food assistance and combat supply disruptions, especially in urban area. And second one, maintain support to lower middle and middle class. Continue to assist more family business to recover. And then extend social assistance mainly for all children and people with disability. Next one. And then specifically for children, we need to have specific pathways to support children and vulnerable groups. Ensure children to have quality learning. At that time, we support to have school open with very rigid health protocols. Keep children healthy and nourished. And then protect children from violence, abuses, and stress, especially from their own family members, from parents, for example. And then recognize and reduce women's care work, because it's been a very important thing to maintain children's well-being too. And enhance social protections to minimize health disruption. Next one. I think that's the last slide. Oh yeah. And then in terms of improving service or delivery of the social assistance is also an important aspect that we learned from this study. So that many people can access that. Also business running by a family. And then we suggest to link new registration to social assistance into single database for future planning. and future targeting. Next one. Oh, that's the last one. Thank you.
Thank you, Mbak Kiki, for your excellent talk. So, yeah, Mbak Kiki, your presentation is very relevant with today's main topic in the multidimensional poverty, especially in the COVID-19 pandemic recovery. Thank you very much for your excellent talk, Mbak Kiki. So, Pak Elan, I would like to continue from Mbak Kiki's last slides, our presentation, in which she highlights the role, the important role of the social protection measures. Pak Elan, could you please like to share with us what are the key social security programs that the government of Indonesia has to alleviate multidimensional forms of poverty during COVID-19 pandemic? And maybe you would also like to share what are the main challenges in implementing those measures, and what are some of the best practices that implemented in Indonesia that maybe other countries might learn from. So please, Pak Elan.
Okay. Thank you, Niken. That's already been like a lot of questions that I have to answer. So I'm not preparing a special slides for this session, because this is designed as the dialogue. But what Mbak Kiki presented, I think it helps us to understand and also confirm that the pandemic indeed is unprecedented crisis that not just hit the economic welfare, the economic aspect of the livelihood, but also other dimension of the livelihood, health, education, food security, and etc. So, knowing that this pandemic actually generate a challenge and then a pressure to the multidimensional aspect of the people welfare or people livelihood, then the key for the government response to be effective in protecting the people's livelihood, the people welfare, is at least two. One, that the policy measures need to be as comprehensive as possible. It's not just giving a cash transfer. Of course, this cash transfer is important, just like for the previous crisis, but there should be also like accompanying intervention that also address the other dimension that affected by the crisis. Second is the timely manner of the response from the government, the policy response from the government. So with these two principles, the government, that's what the government actually used as the basis to act when the pandemic hit the country March 2020. So first, knowing that while we have the vision, the government of Indonesia have the vision on what will be the comprehensive social protection will be. But this country is in the process actually in building the more comprehensive social protection. So it will take some time to, if we like, to also create a new measures, a new intervention. So what is more feasible and that's what the people needed is to start with the current program, and that's what the government did in March 2020, April 2020. So what the government did to respond the pandemic hit is that launching the current program, but expanding the programs in terms of the coverage, because government knows that the pandemic is not just adversely affected the current program beneficiaries, the poor, and then the vulnerables, but there's also like the new poor, the new vulnerable groups, those that pre-crisis, pre-pandemic, they basically their livelihood is actually fine, even and then they basically don't need the support from the government. But when the pandemic hit, many people got sick, many people lost the job, things like that. Many people experience the price increase, things like that. So it like give the pressure to their livelihood. So government knows that the situation, so the government then expand the program coverage. For example, program Sembako, which is basically provide the affordable, the support for the beneficiaries to access the food, rice, eggs, but also other food item like vegetables and protein source food item. Government expanded from like 18 million to like 20 million. Also, another available program that government used to protect the poor is the PKH. There's like slightly increase in terms of the coverage, as well as the electricity subsidy, and also health insurance, which is very crucial in the time of the pandemic. And it's not just expanding the coverage of the current SB programs, but also increase the benefit size for the people that affected by the pandemic, for them to cope better with the pandemic. So many of these programs, like for example, the program Sembako, their initial pre-pandemic benefit size like 110 rupiah, 110,000 rupiah per month. It's increased to the 150 per month, 150,000, and later on even increased to the 200,000. Government also increased the size of the subsidy, electricity subsidy, as well as changed our CCT program PKH. It used to be paid like every 3 months because it did like assessment on the conditionalities. But government changed for the monthly payment for the household to receive more frequent, more regular support. So from 3 monthly to 1 monthly. So these changes in the current SP programs that I think at some point help the people that affected by the pandemic. But then in the next few months, government even more progressive moving with the new programs. So knowing that it's not just the regular or the poor, the vulnerable, including the new poor and new vulnerable household that affected by this pandemic. The assessment is that the current program is not necessarily providing sufficient protection for the people. So then later in that year, government also launched the new programs like that target the micro and small enterprises. So there is a program like Bantuan Produktif Usaha Mikro, so basically like a productive support for the micro and small enterprises. Wage subsidy for that targeted the low wage labor, low wage workers. There is also programs like Prakerja that provide this is interesting. I'll discuss later about this. But the program was initially designed as just provide the training for the upskilling, reskilling, increasing the productivity of the poor and then the vulnerables. But then knowing that the program has the on-demand features for accessing the program, so government combined the program with the cash transfer to reach better those that not necessarily that in the current design only target those that already been in the government database. So again, I think during this at least early 6 months after the pandemic hit Indonesia in March 2020, government first moved forward with the current program, expanding the coverage, increasing the program benefit. But then later on in that year, government also launched several others new intervention to protect better to provide more protection, not just for the existing target group, but also for the new target group that in pre-pandemic they didn't receive the program, but during the pandemic they're the one also that include in the group that affected by the pandemic. So I think we experience, and at the end we see that the poverty rate increased even since March 2020. So and then continue to increase in September 2020. But on the March 2021, we start to observe that the poverty rate is actually start to go back to return to the declining trend. And I think at least some of them should be attributed to the timely response, and also the expansion of the SP program, social protection program, one through the existing program, but also for the new program. I think many of you knows that in 2020 only, government expand the budget for social protection 4 times than the pre-pandemic level, and that's contribute a lot actually to in protecting the welfare of the people. So if we should do better, what can be done better? So what is the challenges actually in protecting the poor, the vulnerables, the society in large facing the pandemic? Mbak Kiki already mentioned some. Yeah, I think one of the main challenge is basically the beneficiary data, the targeting data. We used to be, but even until now, we rely a lot on the DTKS, data terpadu kesejahteraan sosial, which is the main beneficiary data for the government programs used by the line ministries at the central level, but also used by the local governments. The data consists of the bottom 40% of the population. Yeah, but I think even in 2018, 2019 pre-pandemic, we already raised the issues with the data, that the data lack of the updating. There's some efforts, but I don't think that that really solve the main issues in the data, because the design, the mechanisms of the updating is not really designed well and also implemented well. So when the pandemic hit the Indonesia, so 2 issues related with the data. So the program, the coverage of the data can only reach the bottom 40%, while those that affected by the pandemic, it's even above that. So I think some estimation shows that bottom 50 or at least a bottom 60% of the population is actually affected by the pandemic. So when the data only can cover the bottom 40%, so the challenge is how to cover those that not in the database but affected by the pandemic. The second one, as I said before, it's the lack of updating, cause the data out of dated. The information in the database is out of dated. There are some household that of course still remain to deserve to be in the database, but there are some household that supposed to be already be better off, and they're supposed not in database. And on the other hand, there are some new household, new families that even during the pre-pandemic, they actually need to be included in the database, but that didn't really happen. So the accuracy is another challenge in the DTKS. Another challenge is on the absence of the dynamic updating. So what we have so far is what I said before is related with the regular updating, but our social protection system will also need the dynamic updating in terms of the bottom-up registration, or I think what we know in the international practices as the on-demand application. Yeah. So people then, I think, even with the best method, with the best approach, the top-down enumeration that conducted by the government or the statistical offices will still exclude those that perhaps in the remote areas or their residency actually moving around, things like that. Yeah, the homeless, things like that. So the database, the data system should also be equipped with the what we call as an on-demand application, where people can register when people actually can apply to be included in the database. That's what still absent during the pandemic. Yeah, I think we try scatteredly with some application here and there, including for the micro and small enterprises, including for the subsidi upah. Yeah, but again, a more concerted, a more systematic effort need to be developed and then to be included in the social protection system. The third challenge is that while it's already been 4 times budget increase compared to the pre-pandemic, program expansion, program increased benefit, but there are still some areas of some forms of the vulnerabilities that not covered by the current policy measures. One is, for example, the elderly. We don't have yet really a program intervention that covered and target sufficiently the elderly group. We know during the pandemic, the elderly group are among the most group that really vulnerable to with the pandemic. Yeah. But there's I think lack of the support, lack of protection for this elderly group, yeah, including disabilities. So we already have the program to support the elderly, to support the disabilities since years ago, but the coverage is quite small, and the advocacy. I think many line ministries, including us in the office of the Vice President, has been trying to advocate better that Indonesia also, not just because of the pandemic, but also considering that Indonesia entering the aging population, need the special program that protect the elderly group better, and also the disabilities. As well as, I think it's interesting to mention that the pandemic also cause mental health, violence. That's the area that I think government not yet able to tackle effectively, and I think that should be the homework for the government in coming years. I think I stop there first.
Okay. Thank you, Pak Elan, for your explanation. I think I saw many people here are busy taking notes because your presentation it has so many comprehensive explanation that help us understand the importance role of the social protection programs during the COVID-19 pandemic. So let me proceed with our third speaker first. So we have Dr. Usha Kanagaratnam, who is joining us online. So maybe can we see Dr. Usha on the screen, please? Okay, so well, we are trying to connect with Usha. So maybe the questions for Usha that I would like to address in this occasion is, what is the role of the Global Multidimensional Poverty Index? And also, would you please share with us why does it matter in the relation of the multidimensional poverty in the midst of the COVID-19 pandemic? And where is Indonesia in this global measure? So Usha, I think you're already here. Hi Usha, how are you? You're still muted, Usha. Could you please unmute yourself? Okay.
Hey, hi.
Hi,
can you hear me? Hello?
Yeah, would you like to answer the question that I addressed earlier, or do I need to repeat it?
No, the questions were clear. Thank you, Niken. Thank you for moderating. I hope my voice is clear. Is it okay for me to continue?
Yeah, it's clear, and I think you have your file to share, right? We will
Yes,
help.
if you can pull up the PowerPoint.
Okay, cool.
Great. So I very quickly, I would just like to say thank you to you, Niken, for moderating. I would also like to thank Jasmine and Inowa, who's supporting the panel today with their sign language. And not to forget my co-speakers of this panel, Ms. Bakti and Dr. Elan Satriawan, for their very informative and timely discussion on Indonesia's poverty situation and the social protection system and its relevance in mitigating poverty during this very challenging times. So thus far, the focus has been on Indonesia, and my participation on this panel brings a bit more of the global perspective. So just drawing upon what Dr. Elan Satriawan has said, which is on the social security or the social protection systems that is in place during the COVID time. If you could go to the next slide. So the figure that you're seeing in front of you right now shows the association between multidimensional poverty and the emergency social protection for 45 countries. And this includes Indonesia as one among the 45 countries. And these 45 countries represent some 1.6 billion people across the world. Now, I'm using the word global quite liberally here because the coverage is only 45 countries. But this is just to give you a bit of perspective of what's happening around us. So the x-axis or the horizontal line of the graph shows the multidimensional poverty value using the most recently published results from the Global Multidimensional Poverty Index, or widely known as the Global MPI. Now, I will come back to it in a bit. What is the Global MPI and its strength? But looking at that particular horizontal line, countries, the most further on the horizontal line are poorer. So these are a group of countries like Burkina Faso, Chad, Central African Republic that make up the poorer group of countries, while countries like Peru and Costa Rica are the least poor. Now, the y-axis, which is the vertical line of the graph, indicate the percentage of households that have received any kind of assistance since the start of the pandemic. Now, the data on the social protection was collected from these 45 countries through high-frequency phone surveys during the pandemic. And countries further up on the vertical line indicate that they have more social protection during the pandemic. And you can see the group of countries there, which is the Philippines, Georgia, Indonesia, Mongolia. Now, just looking at this graph generally, it would indicate to us that households in high MPI countries, poorer countries, were less likely to be covered by emergency social protection. So it would lead us to assume that countries in which people are in many ways least able to cope with pandemic-induced socioeconomic vulnerabilities or socioeconomic shocks are less likely to benefit from sufficient social assistance to protect their lives and livelihood. And I would agree on Dr. Elan Satriawan's comment earlier on, which indicated that despite all the challenges, the government of Indonesia did move relatively quite quickly when you compare it with many other governments around the world. But it is also important to point out that this, kind of like this sort of global analysis should be taken with a pinch of salt, because it also relates back to something that he said, which is the data that is collected during a pandemic time. It has its own limitations. So, for example, this is data that was collected through high-frequency phone surveys, and so which it raises question: what happens with people who lack phones? And the poorest of the poor, the homeless, usually do lack these facilities. So we are already excluding the most vulnerable out of this sort of analysis. But the reason why I'm showing this today is sort of just to give a context to the discussion that's happening within Indonesia, and just to say that there are challenges even at the global level, but with this preliminary data, and as much as it has its limitation, there is a pattern here, which is that most likely multidimensional poverty is negatively associated with the receipt of social protection during the pandemic. Now, through this morning, we have been engaged in discussions related to the many dimensions of poverty. So please let me take a side step to share with you the Global Multidimensional Poverty Index, or widely known as the Global MPI, that we at the Oxford Poverty and Human Development Initiative, or known as OPHI, produce on an annual basis. Next slide, please. Just to recollect what Sabina said in her earlier session, that this is a global measure that covers 100+ countries. And so for across 100+ countries, we have a fixed set of indicators because we're comparing countries. And so it's of course important to define the indicators and construct the indicators exactly the same as across 100 countries. And these indicators represent a measure of acute poverty. But when you're talking at a country level, it's strongly recommended, or it is the must for any country to develop their own measure of poverty, because the priority for a country is its people, the poverty situation they're experiencing, the vulnerability that they are experiencing. It's not about comparing their country with another country. Now, this global measure is developed, constructed, and published by an academic institute like us, who's working in hand with international organizations, and hence, it's applicable to construct a measure that compares across countries. But do keep in mind that the reason why I'm saying this, that there is this limitation, that this cannot be automatically adopted into Indonesia, is because Indonesia in itself is a complex country with 34 or 35 provinces, with such huge variation. The selection of indicator must involve dialogue between many entities, not just the government, but it starts from the government equally with the community across these different regions and districts. And that is the complexity. Now, the global MPI, which has been measured since 2010 and has its own challenges, does not have that sort of intensity in terms of involvement from governments up to communities. But I'm using the global MPI as an example because to let you know that there are a number of methodologies that would allow you to construct a multidimensional measure. But the methodology that is used to construct a multidimensional measure matters. And I will come to that in a bit. But very quickly, the global MPI has got 10 indicators. Nutrition, child mortality, that makes up health. Years of schooling and school attendance, that make up education. Cooking, fuel, housing, drinking water, sanitation, electricity, and assets, that make up the standard of living. Now, each of these 10 indicators has its own deprivation cutoff. For example, we would identify individuals as deprived in nutrition if they have any child under 5 who is underweight or stunted. And we would identify individuals living in a household as deprived in child mortality if that household has sadly a child under 18 who has perished in the last in the last 5 years preceding the survey year. Now, these cutoffs are not something that is selected by OPHI, but rather these cutoff is in line with the SDGs. The SDGs has established what is the minimum requirement should be to meet the minimum welfare of a person. And for some of these indicators, we follow those cutoff. For example, sanitation, we would say that a household is deprived in sanitation if they have unimproved sanitation or shared sanitation. And this follows the SDG definition. But there are indicators like housing in which we have used, gone with the advice of experts in housing who have said what it means to have an inadequate housing. But this definition may, the deprivation cutoff for each of this indicator may differ when you go within countries. Because at the global level, the cutoff has to be the same. But for Indonesia, probably, the cutoff that will be used for housing may be different, because that needs to reflect the society who's living there and the regional disparity in terms of housing across the country. So the global MPI, one would be identified as MPI poor if she or he is deprived in 1/3 or more of the weighted indicators. Now, when we say weighted indicators, the global MPI has equal weights across all 3 dimensions, and the indicators within each dimension is also equally weighted. Next slide, please. So in a very simplified manner on how do you compute the global MPI, and this is the methodology that we have used, which is the Alkaya-Foster method that underlies the global MPI computation. So let me introduce, before I start explaining the stats, let me please introduce you to Yawala, who's the lady in the picture from South Sudan. Yawala is not her real name, but the person that you're seeing in the screen is real. She lives in a refugee settlement in northern Uganda after having fled from South Sudan due to conflict. Now, in the first step, we're going to build a deprivation profile for Yawala. Yawala and her family is deprived in 7 out of the 10 weighted indicators of the global MPI. And this is shown on your screen as colored boxes. Fortunately, she and her family are not deprived in nutrition, child mortality, and electricity, which is the white box. Now, the global MPI has got very specific weights for the indicators. So, for example, Yawala is deprived in years of schooling and school attendance, which each has got 1/6 of the indicator weight. She's also deprived in 5 out of the 6 living standards indicators, which each receives 1/18 of the indicator weight. And so when you plus 1/6 plus 1/6 plus 1/18 times 5 of the living standard indicators, you will find that in the second step, Yawala's deprivation score adds up to 61%. And since the definition of the global MPI, the poverty cutoff for the global MPI is 1/3 or more of the weighted indicators, which is 33.33%, so which means her deprivation score is above the poverty cutoff, and so she's identified as multidimensionally poor. Now, in the third step, the global MPI combines 2 pieces of information to measure poverty, which is the incidence or head count ratio, and then it is the intensity or the average share of deprivation that is experienced by the poor people. Now, this follows the Alkaya-Foster, well-published Alkaya-Foster method. The MPI value here can range from 0 to 1, and the higher the value it is, it implies higher multidimensional poverty. Next slide, please. Now, very quickly, I'll briefly describe the most recent published global MPI results for 109 countries. Our publication this year, and we do publish it on an annual basis. In October this year, we will be publishing the next round. So this is based on the results that was published last year for 109 countries, representing some 5.9 billion people around the developing region of the world. The good thing about the global MPI is that it's also it has a high resolution lens. It means you can zoom in to the subgroups within the countries. Subnational regions, in the case of Indonesia, it would be provinces, age groups, rural urban areas, ethnic groups, male or female headship, hence making this very relevant for policy purposes. So when you talk about the global MPI, it's not just that one aggregate number, but rather zooming and disaggregating the numbers by these different subgroups. In addition, we also present how poverty has changed over time for a subset of the countries covered under the global MPI. I will later share some findings on how Indonesia has performed over time in later slides. Next slide, please. So Why global MPI matters? The global MPI number is powerful for communication and policy purposes, but more than that, it also sets an example how the computed technical work is done and how these properties are useful for policy purposes. So on average, we find that 22% of the 5.9 billion people that we cover through the global MPI who live in developing regions are MPI poor. Now, disaggregating the MPI unmasks the poorest group, making it also very policy relevant. We know who they are. So almost half, example, almost half of the MPI poor are children under 18. We know where they live. Collectively, some 85% of the MPI poor live in Sub-Saharan Africa and South Asia, and over 84% live in rural areas. Now, we have also extended our analysis to include a gendered and intra-household analysis. So we have zoomed further into the households to see how women or men live across the MPI poor households. And one of the indicators that we analyzed in depth is years of schooling. And this shows that among the MPI poor, so we have 1.3 billion MPI poor people, almost 2/3 of this MPI poor live in households in which no female member has completed at least 6 years of schooling. And so this highlights the vulnerability of these households that lack women with any formal education. So next slide, please. In 2021, we took another step by using the global data and disaggregating the results by ethnicity and also caste. So we had disaggregated the results for 291 ethno-racial categories across 40 countries and 5 caste categories in India. And what we found is that collectively, these 41 countries, which are home to 2.4 billion people, they represent, of this 2.4 billion people, some 28% of them were living in multidimensional poverty, the ethnic group, those who represent the different ethnic groups. But the more interesting part is we also found that poverty varied more widely among the ethnic groups compared to any other subgroups, be it subnational, be it age group. So the variation between the ethnic groups was substantially more higher compared to the other subgroups. Next slide, please. So we also studied part of the poverty trends for 80 of the 109 countries. And here I would like to highlight the progress that has been made by Indonesia using the global poverty measure. Now, the good news is that Indonesia came close to halving their level of multidimensional poverty between 2012 and 2017. Indeed, we will have to keep in mind that this is pre-pandemic data, but I think one of the things to celebrate, as Dr. Elan Satriawan has pointed out, is that we're seeing now positive poverty reduction in the context of Indonesia using more recent data. So hopefully the upcoming 2020 data that we will use to update the global MPI would show even further positive progress, albeit probably a bit more slower given the impact of the pandemic. Now, using this pre-pandemic data across the 5-year period from 2012 to 2017, we estimated that some 8 million people left poverty using the multidimensional approach. So Indonesia's success was also driven by improvement across all the global MPI indicators that was considered for this country. Next slide, please. Now, when we talk about Indonesia, aggregate poverty says something, but I think it matters that poverty has to be studied at and understood at the provincial level. So we disaggregated the findings by the 33 provinces in Indonesia, given that they were available at that time for these surveys. And we find that across subnational regions, 17 of its 33 subnational regions halved their MPI value significantly. Now, there is still progress and that is good, but it also says that there's a bit more to go in context of at the province level. And but the good news here is that we find that the poorest region reduced MPI the fastest. So the x-axis, which is the horizontal line, indicate that the bubble, which represents the provinces, the ones that is the furthest are the poorest one. And the y-axis indicates that the lower you are, you have done much more progress compared to the ones that's at the higher end of the vertical line. So here we find that provinces like Papua, East Nusa Tenggara, and West Sulawesi have reduced MPI much faster compared to other provinces. The next slide, please. I would also take the opportunity, probably, given that this is a T20 event, to highlight the progress that is made in India, which is quite similar to what we have seen in Indonesia, but a bit scaled up, where some 271 million people moved out of poverty within the period of within a 10-year period. So this, in Indonesia, it was a 5-year period because the survey was between 2012 and 2017. Whereas in India, it is a survey that is based in 2015, 16 to, sorry, 2015, 16, and 2005 and 6. So the gap of 10 years. Now, once again, this is indeed pre-pandemic data, but in the context of India, we have a recent data in which it does overlap to some extent with the period of the pandemic, but not necessarily representing what has happened during the pandemic. But hopefully, the latest data would shed some light on how much India has progressed through the T3 time period, and these numbers will be published in October 2017. Now, we've seen these different disaggregations, be it the numbers by age group related to children, by urban, rural, or by by zooming into households and looking at and what's happening between men and women. And then we also have the analysis done at the subnational region, and we also have analysis that is allow us to understand poverty over time. So once again, I would like to emphasize that having a multidimensional poverty is important, but also the methodology that underlies the multidimensional poverty measure matters, because that methodology must allow you to be able to disaggregate the numbers, must be able allow you to identify the most vulnerable, ensuring that no one is left behind, which is in line with the call of the SDG. So my final slide is to do with suggestions that relate back to the earlier sessions. So we did hear that what are the dimensions that matter for in the case of Indonesia, and employment was mentioned as something that is relevant, and this is something that we do at the national MPI level. Is something that number of countries have indicated how important this is. But in the context of global MPI, because it widely uses data from the Demographic Health and Survey and the Multiple Indicator Cluster Survey, and so we have to choose dimensions that exist across all 100+ surveys. And so work is a limitation because it doesn't exist in many of the surveys that we use. So our call here is that do measure poverty in terms of multidimensional as complementary to the monetary poverty that has existed for many years. But in this quest, we also ask that given the situation or given the challenges in the last couple of years, that is pertinent that we invest in data communication and visualization so that it's easier to visualize data related to multidimensional poverty. In addition to it as well, our call is to ensure that new surveys carry questions related to MPI. And this is something that we have observed where actually the global MPI, for example, requires a very small number of questions, only 43, which is a fraction when you compare to consumption surveys, where you will need to have about 450 to 1,000 plus questions in the questionnaire. So including MPI related questions into surveys is not as hard as one would assume, and it is possible and should be priority in the post-pandemic period. And finally, if you need any more information related to multidimensional related work, you'll find links to our website and results that we have published related to global MPI in the final slide. Thank you. Back to you, Niken.
Thank you very much, Usha, for your comprehensive explanation on the MPI and also the methods to measure the indicators. So I would like to move on to the next session, which is discussion, and I would like to invite our attendants here who would like to raise some questions. You can do so by raising your hand, and then maybe mention your name and also your affiliation, and I will try to pick one question from the floor for this first occasion, if there's any. Okay, over here. Pak Asep, please.
Okay. Thank you. I have a question for Pak Elan, about the data for social protection targeting, Pak Elan. For example, di TKS for Indonesia. So right now, in the TKS, for example, the database is based on household as the unit of observation. So in one of the policy brief in Task Force 5, there is a policy brief which argues that in order to have a better and more effective social protection, the database for targeting should be individual based. For example, you mentioned about the elderly and the disability. Because the database now is only based on the household, we just know how many persons in the household is elderly or have disability. But we don't really know their conditions, this elderly and disabled people. But if we have database on individual level, then we will know exactly the conditions of the elderly and the disabled. So I wonder if you have any thought on this, whether this is also feasible or not to be implemented. Thank you, Pak Elan.
Go ahead, Pak Elan, if you want to answer.
Okay. So thank you, Pak Asep, for a very important question. So the TKS, which previously called as a unified database, so I think Pak Suhasil in the morning speech mentioned about that it was developed in 2011 by collaborative efforts between BPS and TNP2K. So we built this DTKS or unified database. It's through the enumeration, direct enumeration, visiting household door to door. But the information that we collected, yes, collect information at the household level, but also at the individual level. So it's just like, basically it's just like Susenas, Pak Asep, where information both at the household and the individual level are collected at the same time. So once we interview, one BPS actually interviewed the household, it collected the information at both levels. So we just don't collect the information, for example, the physical housing characteristics, the ceiling, the floor, the wall, but also we collect the information on for example, the demographic household composition, the age for each member of the household, the employment, as well as the education. So again, we have the information on DTKS, both at the household level as well as individual level, up until 2020, because in 2021, the new policy by the new minister actually removed all the information, most of the socioeconomic information, and then consequently then also on the welfare ranking. So that's why pre-2021, the DTKS in pre-2021, we're able to match the DTKS also with the Adminduk Pak Acep. So 86% of the DTKS, the individual at the DTKS has the Adminduk NIK. Yeah, that's because of the information not just can be extracted at the household level, but also at the individual level. So and that I think that's been since the beginning that has been the source for the targeting data, the beneficiary data for the program that targeted the household, but also the individual programs like it's not just like program Sembako, PKH that target the household or the families, but also program like program Indonesia Pintar that target the school age children. Yeah, and to some extent also program like disability. We have information even at the disability. Also, I think in 2021 when we propose to update the DTKS, we have already the budget. The BPS already been ready to conduct that. Bappenas lead the initiative. We try also to improve the measurement of disability. We use like the Washington Washington Group disability measurements, which consists of the 6 indicators. But again, the new minister has the new policy that while we don't need all this indicator and remove most of them, remove the welfare ranking, and now only the remaining, the so-called, even not indicators actually, not socioeconomic indicators. What left in the DTKS is just like more identity, like nama, alamat, identity, age, for example. Yeah, we still have there, but not indicators that can, describe the socioeconomic level of the household and individual. And fortunately, we have now the P3KE data. Pak Acep, you may heard about this, that we construct from the BKKBN data, pendataan keluarga BKKBN. The data is not as complete as the DTKS, particularly on the asset level, because it wasn't designed as the targeting data. That's more actually for the purpose for the family planning programs, the campaign, consultation, advocacy, things like that. But again, given the situation, the latest situation in DTKS, we no longer have that the socioeconomic indicators. We don't have the welfare ranking. So I think what we can do now with the P3KE data. P3KE is the percepatan penghapusan kemiskinan ekstrim that we constructed, we developed from the PKBKKBN. I think that's the best we have now. There's like 40 indicators. Again, the only main issue is that there's a lack detail in the assets. But other than that, demographic, education, employment, physical housing characteristic, they're all there in this new database, and we use that for targeting the extreme poor.
Thank you, Asep. So while we're also still waiting some questions from online participants, because until now there is no questions, I think I will go to one of those hanging hands. Mbak Esi, are you going to ask a question? Okay, so please over here.
Hello.
Please, Mbak.
Yeah, I'm Esi from Resilience Development Initiative. I'll be straight with my question, and I'm directing this question to any of the speakers. It's quite a general one. As MPI is a widely complicated and nations have diverse economic background, as this is a G20, right? Not say this is not just for Indonesia. Are you, honorable speakers, are positive that this approach will be more mainstream in the future? Is it suitable for us to be optimistic regarding that? Because also, as the previous speaker mentioned, that in MPI, to be accurately capturing the depth or the dimension of poverty, zooming in to the level of individual is important. It will be costly to do that in that much detail. Also, there's also a possibility of bias. So I guess my second question would be, how prevalent these possibilities are, and how to boost the dynamic updating, because that's what mentioned before as a very good way to mitigate these issues, right? Which is how the bottom-up can also apply for themselves. Thank you.
Thank you, Mbak Esi, for the question. So I guess you addressed those questions to all the speakers. So maybe I would like to start with Mbak Kiki. If you have any response to the question, Mbak, please.
Thank you. Thank you for the questions. I would like to share our experience in using a similar kind of multidimensional poverty indicators at the community level. SMERU has been conducted many poverty assessments using participatory approach at the community level, at sub-village or dusun level, or at village level, where we try to assess the local context of poverty conditions. We come up with several sets of indicators. It's multidimensional. It consists of assets, conditions, it consists of health, education, asset ownerships, and also social relations among community members, which is actually kind of similar to the multi-dimensional poverty index that Usha also mentioned here. So in terms of optimistic, I'm quite optimistic because we've been conducted that kind of assessment for some time, even though it's costly, and it's also poses some challenges in terms of how to integrate or match the indicator at the community level with what we have at the national level, and how to formulate social protections that is universal, but can also address the very specific context at the community level. That's the optimistic, but also we have to address some challenges. That's my point of view.
Thank you, Mbak Kiki. So maybe Pak Elan, you can proceed, Pak.
Yeah, I think well, thank you for the question, I see. I believe there is a prospect in adopting the approach, the multidimensional poverty index here. And that would, I think that would help to describe in a better way, in more accurate way, the poverty situation in Indonesia, definitely. Because again, I think while if we recall that if we look at that, if the metric measures try not just to look at the food consumption, but also the non-food consumption like education, health, housing, so that to some extent actually reflect also the other dimension other than food, right? So I think we've been also internally exercising that there is like a high correlation, strong correlation between the multi-dimensional index with the metric measures. I think in the but the method, I believe, I think when we are many of us now are aware that the best that the method will help policymakers, I think, in identifying the source of the vulnerabilities, the source of the poverty, and this is give like the guidance for the government, for the policy makers to address in better way what programs what intervention that needed to address the poverty nationwide, but also at the local, at the regional, at the sub-national level. So, and I believe that I think again in terms of the prospect, it's quite prospective, because I think in the previous session, Pak Sua, Pak Asep already mentioned that Indonesia is the country with the in terms of the access to the data is quite abundant. So in terms of the generating the index, I think it's not the issue. Pak Teguh in the previous session mentioned, I think the issue is more on the consensus, as well as also on the convincing and advocating the. I don't think that the central level will be an issue, but more on the local government, how to accept this. Because once we adopt this, there's a local government that experience perhaps the lower poverty rate, quote unquote, but there's some other regions that will experience the higher poverty rate. That's not an issue with adopting this multidimensional poverty index. Even when we try to revise the metric measures in the last 2 years with the BPS, with the Bappenas, with this new revised method, there's also that will be also the one of the main issues, because when we try to measure the provincial level or district level poverty, there are some districts that experience lower poverty rate with the new measure, with the new poverty line, the new revised poverty, but there are some other province and district that experience higher poverty rate. So again, I agree with Pak Teguh that the technocratic is not the issue, more on the non-technocratic that is the main issues. And for Indonesia, I think I saw what Professor Al-Khair and also Dr. Usha mentioned. I think in terms of comparability, they have like a sets of the indicators with the equal weight. I agree I think for this to be adopted, Indonesia, at least as one of the measures, it's not just perhaps the single measures of the poverty in Indonesia. We need more exercise. I appreciate what has been done by the School of Economics of University of Indonesia, looking at what indicators matters for Indonesia, which definitely arguably will be different with other countries. And so I think we need to go through that process. Is not the main issue, but some exercises, some technocratic work still need to be done.
Thank you, Pak Elan. So maybe Dr. Usha can also join us by responding to the question. If you're still here with us, Usha?
Yes. Yes, I'm here. Can you hear me? Hello? Hello? Hello?
Yes. Hello, Usha. Do you want to respond to the question?
Yes, hi.
Yeah.
So very quickly, thank you for the question. I didn't get the name of the person, but I'm going to challenge on two things here, because I heard two things here, which is MPI is complicated, MPI is expensive. Now I'm challenging this because MPI is complicated. In terms of computation, it is not. At the Oxford Poverty and Human Development Initiative, we produce the global MPI for 100+ countries every year. And this is a job that is done with 2 persons' time. And so it is possible, with the advancement in software development and statistical knowledge that we have, that can be done. But the other part is maybe the complicated part that you may feel is related with the methodology. But as Dr. Elan Satriawan pointed out, it has been there for some time, and it's not too complicated to understand, because in an MPI measure, it's a dual cutoff approach. You first need to identify the cutoff for each of the indicators you've selected, and then you need to decide what is the overall poverty cutoff. But this is very transparent, because for the indicator cutoff, you always have to justify the cutoff with your development plan or with your short-term economic plan. So there's a transparency there already. And with the poverty cutoff, it must be something that also has consensus among the wider group who's involved in the process. Now, in terms of MPI is expensive, as I indicated, even in terms of data collection, MPI-related indicators can be easily inserted and collected as part of any household survey. Now, think about the benefit that you will get from a multidimensional poverty approach. For example, the global MPI, we use about 10 million observations across 100+ survey samples. And this 10 million observation represent 5.9 billion of the world population. Now, in our database, because we have 10 indicators in the global MPI, and it's an individual level information, I know everyone's interrelated or interlinkage deprivation. So if I am deprived in school attendance, I would also know whether I'm deprived in all other 9 indicators. And that is what we call the joint deprivation. And that matters for policy, because as a policymaker, they want to know that if a person is deprived in sanitation, what proportion of them are also deprived in drinking water? What proportion of them are also deprived in housing? And so there can be an integrated policy between the different ministries, and that will save a lot of budget, because you're getting different people coming together to solve problems that addresses the many deprivation that the person is experiencing. So I would really challenge on this notion that MPI is expensive. But as Dr. Elan Satriawan has said, I think I agree with him completely. I think the concern here is more to do with the challenges in coming up with the measure, which is which are the indicators we're going to use. How would we set the indicator weight? What would be the overall poverty cutoff? But that would require, in the context of Indonesia, given that you have the provinces, you have the districts, and you have the community, the academic group. So bringing everyone together and having a consensus and reaching that consensus is what may take time. But even then, it is not impossible.
Thank you very much, Usha, for your response. So I think because the time limit, that's going to be our last question for this session. So I would like once again to thank our distinguished panelists, Mbak Kiki, Pak Elan, and also Dr. Usha, who is joining us, as well as to the audience here who is staying with us throughout the session, and those who are joining us via Zoom and YouTube. I think it's been a fruitful discussion, and I hope it enhances our understanding on the multidimensional nature of the poverty in terms of the COVID-19 pandemic recovery. So I would like to once again invite everyone to join lunch, which is going to be served at the end of the building. And the keynote policy dialogue 2 will start around 1. Let me check. I think it's going to start at 1:30. Again, the room will be going to be a larger room that we entered earlier in the morning for the keynote policy dialogue 2. So I think that's all. Mbak Kiki and Pak Elan, I thank you for your presence. Thank you very much.
Thank you everyone. Thank you, Pak.
Thank you.
Makasih ya Mbak Kiki.
Sama-sama ya. Aduh, dingin banget ruangannya. Makasih ya, Pak.
Terima kasih.